I am Arun Sharma, physician and psychiatrist, and especially working in the area of geriatric psychiatry. And have been in practice since 1988 and have the pleasure of working with a mixed population in adult and geriatric psychiatry. In older adults, depression and many other psychiatric illnesses are just as prevalent and common, and suicide is a major complication of a major depressive disorder, which is present in the elderly. As we all age, that is by itself is not a barrier to developing diseases, but major depression or a depressive illness is the main reason many of the elderly may experience suicidal ideations or intentions and may even attempts. In terms of preventing suicide, which is obviously the main reason we see a lot of our patients, we want to make sure that there is not an underlying diagnosis of depression. Now, there are many other things that can be associated with which makes the risk of suicide in the elderly. And number one being multiple physical illnesses, chronic pain and ongoing pain. These are a lot of co-occurring and comorbid conditions that patient may experience. A lot of the chronic diseases like heart disease, lung disease, kidney disease, also neurological diseases, stroke-like diseases that can be associated with underlying depression, and that can further predispose the person for suicide intent or ideations. In addition to that, social isolation is a major, as we've all gone through a pandemic in the last 18 months, this isolation is further exacerbated and tipped the balance towards such tendencies. Widowhood is another example. Functional decline. As we all age, there is some functional decline, but in multiple physical illnesses and other circumstances, a lot of issues could be related to loss of income, retirement, that also can predispose to certain individuals with episodes of depression that needs to be looked into. Then there could be a family history of depression, or a person may have had depression in the past. And there are certain personality characteristics in individuals can predispose them for depression, and thus making more of a vulnerability towards suicide. There are a number of things that people can do if they're suffering from the condition of depression or any other issues that was just outlined in terms of multiple physical illnesses. The great source is talking to your primary care physicians. 80% of the depression, 80% of the psychological, emotional issues are actually dealt in primary care physician's office. So that is the best contact to have. There are screening tools primary care offices are doing these days, especially in our collaborative treatment model, that can pick up some of these issues related to depression, risk for suicide in the early stages. In medicine, earlier you pick up anything, the better is the outcome. So primary care physician is the right place to approach for this issue.